It's important for the folks in the county to understand that the approach to this is containment. That's a directive right across the country. It's the most effective way for us to control the virus. And I think the important part for people is to follow the rules. We are setting rules out, to follow them, and that is the most effective way for us to contain it here locally and across the country.
The important part is that everybody has a role to play. And what I mean by everybody has a role to play, we at the hospital with acute care, we are ready. We have plans. Again, those are for the sickest of patients. However, what I mean by everybody has a role is, even though you're hearing that a lot of the affected patients are in a particular age group over age 65, even though you're 19 years old and have not a high chance of getting this and having big issues, you may be asymptomatic and not even know it. You can be a carrier of the virus and pass it on to other people. So when we say everybody needs to stay home, we mean everybody needs to stay home, because they can be a vector without even knowing it. And that's the real danger. And so everybody has to do their part.
You can help us by staying home. You can help us by looking after your loved ones at home. By staying home, you're doing what we need to do to contain the virus. And it's really that simple. And it makes you a part of this team, making it possible for our community to do the best it can to protect itself.
It may seem as somewhat punitive, somewhat difficult to restrict your daily life so much, but I want to remind you that all the studies, all the experience in other countries that are started way before us have led the Center for Disease Control and for the World Health Organization to recommend that the acute period, the period of most concern are those 2 weeks of exposure. So our hope is that the more stringent sacrifices that we're asking for will be for a brief period as we're in this current stage of the pandemic. So I believe that there's hope and there's light at the end of the tunnel.